Nerves of upper limb part 2 by the Dr. Shrikant Verma, Cerebellum Academy. So what are the different important questions for the first MBBS students? Long notes are asked. Can you see here beta? Sir, there is a question, describe the median nerve or the ulnar nerve or the radial nerve under the following headings, and it is the question for the 10 marks. Yes, how these are formed, what is the course and what is the branches, and yes, different pointers of the different our clinical points. Agree beta? Now try to get what are the different short notes which are asked from this zone. Describe the median nerve, its course and branches in forearm, because median nerve is the laborer nerve, it is the main nerve of the forearm, that's why. Also the median nerve separately 5 marks question is asked, the course and its branches in the hand. Also remember the ulnar nerve, this is the musician nerve, main nerve of the hand, which is supplying the short intrinsic muscle, so it is asked in the hand, 5 marks. And the radial nerve, it is having the different branches in the our arm portion, so this is another 5 mark question for all of you. So according to the different states and different universities, we are making the important question, no excuse with this topics with this question. So we are starting our today's session with the median nerve. So try to understand. Yesterday we had seen all the nerves of the brachial plexus. Sir, yes, all the nerves of the upper limb, they are formed by the brachial plexus. Do you remember? In our brachial plexus, there was the our lateral cord and the medial cord. Yes, sir. The lateral cord, it was giving rise to the lateral root. Medial cord, it was making the medial root, and both are uniting to make the median nerve. In yesterday class, we had seen, sir, median nerve is having the two roots, lateral root and our, yes, medial root. Correct, sir? So there are the two roots, lateral root and the medial root, which is making the median nerve. So one diagrammatic presentation as well as our three-dimensional orientation, how the median nerve is running in our upper limb part with the our Tony Stark Iron Man style. Can you see here? Sir, the bunch of the nerves, yes, it is coming from the our brachial plexus. Can you see the median nerve? Yes, sir. This is our median nerve, which is arising from the brachial plexus, having the two roots, lateral root and medial root. Okay, sir. Now this median nerve is running in the arm. Remember, it is giving no branches in the arm. Then it is running in the our, yes, it is coming into the cubital fossa. Do you remember? MBBR, बेटा एग्जाम पास है, कम से कम इतना जरूर याद रखना, in the arm it is not giving any branch, then it is coming into the our cubital fossa. Yes, there is a relation MBBR. Also remember, in your textbook it is given, this median nerve is giving the vasomotor branches to the axillary artery and our, yes, you can say brachial artery, but that is not important, so you can skip. So MBBR, M for median nerve, then there is a brachial artery, then there is a biceps tendon, and then there is a radial nerve. Okay, sir. Now it is reaching into the our, yes, forearm. It is the main nerve of the anterior compartment of the forearm. Yes, remember, all the muscles of the anterior compartment of the forearm, these are supplied by the median nerve except flexor carpi ulnaris एंड फ्लेक्सर डिजिटोरम प्रोफंडस. वाई? क्योंकि बेटा ये जो मसल्स हैं ये मीडियल साइड की है, एंड आई टोल्ड यू जो नदी जहां रहती है, जहां बहती है, उस एरिया को सप्लाई करती है. एंड ऑन द मीडियल साइड सर देयर इज अ अल्नर नर्व, सो अल्नर नर्व विल सप्लाई टू द फ्लेक्सर कार्पाई अल्नरिस and flexor digital profundus. Remaining all are supplied by this median nerve. Now this median nerve is going towards the our hand, and remember it is passing through the very important structure, that is our, yes, flexor reticula. So it is passing below the flexor reticula where there is the our tunnel at the carpal region. So it is passing below the carpal tunnel, it is dividing into the different branches. It will give the many muscles of the our hand. Yes, thumb muscles, they are supplied by the median nerve except adductor pollicis, thenar muscle. And remember the first and second lumbrical, these are supplied by the median nerve because these are located here. मैंने फिर से आपको हमेशा मैं ये कहता रहूंगा, median nerve is passing from the thumb side, so it will supply the muscles of the thumb, it will supply the skin near the thumb. जो नदी जहां रहती है, जहां बहती है, उस एरिया को सप्लाई करती है, our Hilton law. Okay sir, while the ulnar nerve will pass through the ulnar side. Okay, so here it is giving the sensory and the motor branches. So with this three-dimensional orientation, we are going to understand our, yes, this diagrammatic presentation. Yes, Nimit Malik, hello beta. Hope you all are having all the things proper with the clear concept. Please watch yesterday video, okay? And yes, make this session interactive so that we all can enjoy this one, okay? So remember always, you have to focus over your target. कौन कहता है आसमान में सुराख नहीं हो सकता, तबीयत से एक पत्थर तो उछालो यारो। याद रखो बच्चों, आपका एग्जाम पास है, लेकिन अगर हम प्रॉपर फोकस करते हुए इस चीज को क्रैक करें, फर्स्ट एमबीबीएस में अगर हमारे अच्छे नंबर आते हैं तो पूरा एंटायर एमबीबीएस लाइफ हमारा बहुत स्मूथ जाता है। ओके सर, सो व्हाट आई वांट टू टेल यू, मीडियन नर्व। सर, दिस मीडियन नर्व is having the two roots. One simple diagrammatic presentation, quick revision for your exams. Yes. So, one diagrammatic presentation. Can you see? There is a brachial plexus. Here are the lateral root and medial root. Now, median nerve is formed. Yes, it is running in the arm. It will give no branch. Yes, here there is our muscle, coracobrachialis muscle, from where the medial intermuscular septa starts. Getting the point? Remember, this median nerve is coming, fine, and it is running in the our anterior compartment. And yes, there is our also the brachial artery. The brachial artery, axillary artery is coming. The brachial artery is coming here. Initially, the median nerve is lateral to the brachial artery, but at the level of the coracobrachialis insertion, it is crossing. It is very important viva question. At the CBI, coracobrachialis insertion, it is crossing the artery from lateral to the medial side. Okay, sir. And then it is running medially. At the cubital fossa, we all know the relation is the MBB and another nerve is R. So remember, labeling for all of you, sir, it is having the lateral root, it is having the medial root, and these are making the median nerve. Yes, sir, this is our brachial artery. Remember, at coracobrachialis insertion, this median nerve is crossing the brachial artery from lateral to the medial side. Very important viva question. And here in the cubital fossa, we all are aware, sir, relation is M, B, B and R. Sir, M for median nerve, B for brachial artery, B for biceps tendon, and R for radial nerve. These relations are from medial to lateral. Better no excuse. सोते जागते उठते बैठते खाते पीते ये याद रहना ही चाहिए. Now this nerve is running in our forearm anterior compartment. Yes, Varun. Hello, beta. Hope you all are getting the point. Yes, Shashank is here. Yes, so today there was the our FMG exam and Shashank is saying that little bit anatomy questions were tough. You are right, beta. First session was tough and these basic questions were difficult, and especially the anatomy directly 8 9 question came, and with the integration to the other subject many other questions. Okay, yes, good evening Shreya, kaise ho beta? Okay, yes, medial most structure. So hope you are getting the point. Anything you can comment. I am having one eye over the chat box also. Okay beta, okay, yes. So now when this nerve is reaching into the anterior compartment, there is a one muscle, pronator teres. This pronator teres is having the two head, superficial head and the deep head. So this nerve is passing in between these two head. Remember one very important clinical, if there is the compression of the median nerve in between the two heads of, yes, pronator teres muscle, this is our pronator teres syndrome. This is your clinical question. What I want to tell you, this is the median nerve which is passing in between the two heads of the pronator teres muscle. Sometimes this median nerve is compressed in between the two heads of the pronator teres muscle. This is known as pronator teres syndrome. Now this nerve is running in our forearm. Here it is giving one deep branch. Yes, sir. This deep branch is running in front of the interosseous membrane. What should be the name? Sir, this is anterior interosseous nerve. Important. What is this anterior interosseous nerve, beta? Remember, it is our deep branch of median nerve. Getting the point? Now, here over the carpal bone, you all know there is the our one modification of the deep fascia. This deep fascia modification is responsible for making the tunnel. Yes, it is making the one canal which is responsible for the retention of the long flexor tendon. Can you see? Yes. Look at this structure. You all are aware about the different kind of our carpal bone. Yes, she looks too pretty. Try to catch her. Means scaphoid, lunate, triquetral, pisiform, trapezium, trapezoid, capitate, hamate. Over this all structure, you can see one modification of the deep fascia. Just below it there is the one tunnel. ध्यान से देखो बेटा, three dimensional anatomy. Yes sir, there is a one canal. This is located over the carpal bone. So this is our carpal tunnel. Remember, the median nerve will pass below it. This structure is responsible for retaining, for holding the flexor tendon. That's why it is known as the flexor reticula. Flexor reticula. नाम को तोड़ो और सोचो फिर से. अर्ज किया है, शेक्सपियर ने कहा है नाम में क्या रखा है, लेकिन हम इंडियन तो मिर्जा गालिब के दीवाने हैं. मिर्जा गालिब कहते हैं सारे राज नाम में दफन रहते हैं. फ्लेक्सर रिटेनक्यूला, इट इज रिटेनिंग द फ्लेक्सर टेंडन. दैट्स व्हाई समटाइम्स शॉर्ट नोट्स आर आस्क्ड अबाउट दिस क्वेश्चन आल्सो. यस उजमा, यू आर राइट बेटा. यस, okay. So now this nerve is coming and it is passing below the flexor reticula. Yes sir. If here is a compression of the median nerve, then there is a carpal tunnel syndrome. Very important short note for the first MBBS students as well as MCQs. Okay, now this nerve will give the motor branch and the sensory branch. Just diagrammatic presentation. Sir, it will supply the lateral 3.5 of the finger. It will supply all the thenar muscle, yes, thumb side muscle, except adductor pollicis, and it will supply the first and second lumbrical, means only the 5 muscles. So this is the point which you must remember. Okay, now what I want to tell you, this is the one diagrammatic presentation of the median nerve. You have to draw this diagram. See here how you will show formation of the median nerve, then course in the axilla, then in arm, then how it is running in the forearm, then how it is running in the hand. So this is the way how you have to describe. Sir, any nerve, first you have to say about the formation, then course in axilla, then from axilla into the arm, then from the arm into the forearm, then into the hand. Okay, so let's start this one. आराम से बेटा, बहुत आसानी समझ में आएगा. Sir, this median nerve was formed with the help of the two roots, lateral root, medial root. Agree sir? Lateral root is formed by the C5, C6, C7. Correct sir? While the medial root is formed by the C8 and T1. Done. Now this median nerve is running in the axilla. How many branches? No branches. Your Viva question, MCQ. Now it is reaching into the arm. Correct sir? Important point, it is crossing the brachial artery sir. It is crossing the brachial artery from lateral to the medial side. Getting the point? Yes, it is crossing the our brachial artery from the lateral to the medial side. Now it is reaching into the our cubital fossa, and we all are aware about the relation MBB and R for radial nerve, which is not shown in this image. Median nerve, then brachial artery, then our biceps tendon, and then there is the location of the radial nerve showing with the yellow color. Now this nerve is coming and it is passing in between the two heads of the which muscle? Sir, pronator teres muscle. Yes, it is the short, sweet, quick revision series for the first MBBS students for your exam help. So I am taking the help of this picture. Okay, and again I want to tell you, this annotated file you will get within the our cerebellum app. Okay, yes, this is our pronator teres muscle. It is piercing the pronator teres. Remember, this is the very important MCQ, that this median nerve pierces which muscle? Pronator teres. It is passing in between these two. So if there is a compression, I told you pronator teres syndrome. Okay, now it is giving one deep branch, which is the anterior interosseous nerve. Remember this nerve, very important, your Viva and MCQ. Anterior interosseous nerve is nothing, sir. It is the deep branch of the median nerve. What it will do? It will supply all the deep muscles of the anterior compartment of the flexor compartment. Okay, yes, all the tendons, all the muscles of the our deep compartment, deep part of the entry compartment. What are the deep muscles? Try to remember. Flexor, yes, responsible for the flexion of the thumb, flexor pollicis longus. Another is flexor digitorum profundus. Remember the flexor digitorum profundus, it is hybrid muscle. The lateral half is supplied by एंट्रीनट्रोशियस नर्व, मीडियन नर्व, बट मीडियल हाफ इज सप्लाइड बाय अल्नर नर्व, क्योंकि मीडियल की तरफ किसकी नदी है? अल्नर नर्व की, लैटरल की तरफ किसकी नदी है? मीडियन नर्व की. एंड देन इट इज सप्लाइंग द प्रोनेटर क्वाड्रेटस मसल, इट इज supplying the wrist and inferior radial ulnar joint, and it is getting end. Okay sir, but this our superficial branch, it will supply all the superficial muscles. What are the different superficial muscle? Yes, it will supply to the pronator teres, it will supply the flexor carpi radialis. Think about it, नाम को तोड़ो और सोचो. It is taking origin from the flexor point, it will go towards the carpal bone and it is running towards the radial side. That's why it is supplying the next muscle palmaris longus, it is supplying the flexor digitorum superficialis. Okay sir, now it is running in between the flexor digitorum superficialis and flexor carpi radialis, and then it is running deep to this flexor retinacular. Remember, it is running deep to this flexor retinacular within the carpal tunnel. So very important question, if there is a damage, there is a carpal tunnel syndrome. Getting the point better? Okay, okay, yes, yes Varun, it will be very helpful for the revision of the clinical subjects also. You are right better. Now see, it is important what is the course of this median nerve in the hand. So you can see it is giving one palmar cutaneous branch, lateral half of the palmar skin before the flexor retinacula. So if there is a carpal tunnel syndrome, remember the sensation over the thenar eminence will be normal. Kyun? Because this cutaneous branch is given before the flexor retinacula over this thenar eminence part. Okay, while you can see here it is giving the muscular branches, and these muscular branches are supplying all the thenar muscle. You can remember with the AFO. AFO is your mnemonic. A for abductor, it is acting over the thumb, that's why pollicis is small muscle, that's why brevis. Next is flexor pollicis brevis. Next is opponens pollicis. Except adductor pollicis. Adductor pollicis is the graveyard of the ulnar nerve, so it is supplied by the our ulnar nerve. And you can see it is supplying the first and second lumbrical also. And then it is giving the digital branches which is supplying the lateral 3.5, 1, 2, 3 and half of the skin on the palmar side, and at the back these nerves are taking turn and supplying the nail beds part. Agree beta? So this is the one very useful diagram. It will be available in our app as the annotated file. Now what are the important clinical integration from where the viva question, MCQs as well as sometimes the short questions are asked. So what are the different tests for the median nerve? So remember the Captain America joined the Avenger team. क्यों? क्योंकि वो MBBS नहीं कर पाया, वो सिर्फ बैचलर इन फिजियोथेरेपी रह गया. So this is the one funny mnemonic. The Captain America was the bachelor in physiotherapy. So our mnemonic is CAP BPT. So remember the median nerve. Sir, median nerve is having injury and it will manifest with the C for carpal tunnel syndrome. Remember, recall, revise with me. A for apt thumb deformity, yes, P for pointing index, which is also known as the Oshner clasp test, then B for Benedict hand, also known as the Pope hand deformity, then P for Fallon test, also P for, you can remember the pain test, and T for Tinel sign. So these all are tests related with the median nerve, no excuse. Hope you all will like this mnemonic. Okay, beta? Now we are looking one by one the important clinical point. So first is our carpal tunnel syndrome. I am looking for any chat. Okay, yes, okay, Atul is here, so thank you Atul for joining. So any kind of doubt you can ask. First we are talking about our carpal tunnel syndrome. We all know sir, there is our flexor retinacular. बेटा फर्स्ट MBBS के बच्चों को जब एक्सटर्नल आएंगे एग्जाम लेने के लिए पूछेंगे वेयर इज द लोकेशन ऑफ द फ्लेक्सर रेटिनाकुला, शो विद द टू फिंगर. तो बेटा दो उंगलियां रखनी है अपने फ्लेक्सर, अपने कार्पल बोन के ऊपर. सर इट इज द लोकेशन ऑफ द आवर फ्लेक्सर रेटिनाकुला थ्रू विच below it the our median nerve is coming and it is giving the sensory and the motor branches. Can you see 1, 2, 3 and half of the finger they are supplied by the our median nerve. What happens? Remember, due to autoimmune disease, one etiology, due to the myxedema, due to the pregnancy or the computer typewriter, they are having repeated injury or compression of the median nerve below the flexor reticula or the carpal tunnel. Sir, it is the carpal tunnel syndrome. There is the sensory abnormality along the 3.5 of the digit, as well as there is a compression of the median nerve. So there is a thenar atrophy. You will see the app thumb deformity. Yes, so this is important point. What you will see the other signs? Yes, tinel sign you will get in case of the carpal tunnel syndrome. Very important. Remember, you have to tap over the flexor reticula. So the patient will say there is the increase in the pain along the lateral 3.5 of the finger. Sir, it is the positive tinel sign. Remember, this positive tinel sign is found पॉजिटिव इन केस ऑफ द कार्पल टनल सिंड्रोम. तो सोचो बेटा, अगर आपका कार्पल टनल सिंड्रोम शॉर्ट नोट है, आपने टिनल साइन भी लिखा, कितना बढ़िया आपको नंबर मिलेगा. यस, नाउ सी द phalanx टेस्ट. सो यू हैव टू आस्क द पेशेंट टू डू दिस मैनूवर, excessive flexion at the wrist joint. So in this condition, the median nerve is getting compressed just below the flexor reticula. So you will observe there is the increase in pain along the lateral 3.5 of the finger. Again, remember, it is positive in case of the carpal tunnel syndrome. So it is the test for the median nerve. How you can remember? One funny thing, just tap over this. Okay, जैसा मैं कर रहा हूं वैसा करो. Yes, tapping, tinel, fall, phalan. Both are the test for the our carpal tunnel syndrome. Both are the test for the median nerve. सो फनी वे, आपको टैपिंग करना है कार्पल टनल के ऊपर, दिस इज द टिनल साइन. आपको फॉल करना है हैंड को ऑपोजिट वे में, फॉल कर रहे हैं तो फैलेंस साइन. तो नहीं पढ़ने के 100 बहाने, लेकिन पढ़ने के 1000 बहाने. आप इसे बहुत ही आसानी से याद रख सकते हैं. नाउ लुक हियर, इफ वी ऑल आर फैन ऑफ द our जैकलिन फर्नांडिस आंटी, then we will miss all the concept. क्योंकि ये कहती है चिटिया कलाइयां वे, यस मंजावे, मैनू शॉपिंग करा दे, मैनू पिक्चर दिखा दे. लेकिन आपने देखा होगा कोई इसको पिक्चर नहीं दिखा रहा, कोई इसको शॉपिंग नहीं करवा रहा. क्यों? क्योंकि ये कहती है कि कलाई यहां पर है. रिमेंबर, योर एक्सटर्नल विल कम एंड ही विल आस्क वेयर इज योर रिस्ट. ये बेटा रिस्ट नहीं है, रेडियो कार्पल जॉइंट इज बिलो और इसके ऊपर में कार्पल बोन है, तो यहां पर फ्लेक्सर रेटिकुलर होता है. व्हाई आई एम टेलिंग, सी हियर, कार्पल टनल सिंड्रोम, एनी नर्व कंप्रेशन, व्हाट यू हैव टू डू, नर्व का कंप्रेशन है तो आपको नर्व को स्ट्रांग बनाना पड़ेगा. बायोकेमिस्ट्री इंटीग्रेशन, यू हैव टू गिव द विटामिन B1, B2, B9, B12, yes, B6 means multivitamin you have to give. You have to ask the patient treatment. I am telling you, yes, you have to ask the patient for the exercise, but if not treated then give the painkiller, if not treated then give the steroid, the best anti-inflammatory drug. Okay, लेकिन अगर इससे भी ठीक नहीं हुआ तो सर्जरी. और अगर आप जैकलिन आंटी के फैन हैं तो सिचुएशन में कलाई यहां है बोलेंगे, लेकिन बेटा कलाई यहां नहीं है. कलाई अगर आप यहां है तो यहां इंसिजन मारेंगे और उस कंडीशन में फिर खोजते रहेंगे, अरे फ्लेक्सर रेटिकुला किधर गया, आपको मिलेगा ही नहीं. फ्लेक्सर रेटिकुला इज लोकेटेड ओवर द आवर कार्पल बोन, सो यू हैव टू गिव द इंसिजन हियर. रिमेंबर, एक अच्छा सर्जन बेटा वो है जो मिनिमम इंसिजन देता है, मिनिमम स्कार प्रोड्यूस करता है, उसे लोग ज्यादा पसंद करते हैं. नोबडी लाइक्स द अगली स्कार. तो आपको ये एनाटॉमी जो है सर्जरी में, ऑर्थोपेडिक्स में हेल्प करेगी. यू हैव टू कट द फ्लेक्सर रेटिकुला, यू हैव टू रिलीव द प्रेशर. दिस इज ऑल अबाउट द शॉर्ट नोट फॉर द कार्पल टनल सिंड्रोम. वेरी इंपॉर्टेंट. नाउ एप थंब डिफॉर्मिटी, वी ऑल नो द मीडियन नर्व इज कमिंग फ्रॉम दिस साइड. सो इफ देयर इज अ कंप्रेशन ऑफ दिस मीडियन नर्व, देयर इज atrophy of the thenar muscle, it becomes flat. So this is appearing just like the thumb of the ape monkeys. That's what is our ape thumb deformity. Remember, it is due to the median nerve damage. Getting the point? Yes, Uzma auntie, we will say, so that we can remember for the better time. Now this is the one beautiful median nerve test, Pope hand deformity, benediction hand deformity. Remember, if median nerve is getting injured at our cubital fossa part, then you will ask the patient to flex the finger. He will not be able to flex the finger. But do you remember the flexor digitorum profundus, the hybrid muscle, the medial half is supplied by which nerve? Answer is ulnar nerve. So ulnar nerve is okay. So patient will be able to flex the flexor digitorum profundus. So the both fingers will be flexed in this way. So the patient hand will be in such kind of the manner when there is an injury at our cubital fossa. And this position is just like the hand position of our Lord Yeshua Masih, or you can say one Pope Benedict. So this is the median nerve injury at the cubital fossa. This is the Pope hand deformity or Benediction hand deformity. Now this is the your MCQ NEET PG 2021. बेटा यहीं से तो क्वेश्चन आने वाले. अगर आप cannot be strong रहेगा, yes, your all the 18 subject will be strong, you will perform very good in all the other subject. इसलिए बेटा मैं एक चीज कहता हूं मेरे बच्चों, मैंने कहा था ना 18 सब्जेक्ट पढ़ने से पहले एनाटॉमी पढ़ा जाता है. सो दिस द वन फेमस डायलॉग फ्रॉम माय क्लासेस इन स्टाइल ऑफ द शकुनी मामा. तो बेटा अगर आपका एनाटॉमी स्ट्रांग है तो हर चीज स्ट्रांग होगी. यस, हाउ यू विल टेस्ट द मीडियन नर्व नीट पीजी 2021 क्वेश्चन. यू हैव टू आस्क द पेशेंट टू टच द पेन. इन दिस ग्रीन बैकग्राउंड आई एम शोइंग यू. यस सर, the patient will abduct the thumb. Getting the point? If he is touching the thumb, means proper abduction is there, means abductor pollicis brevis is okay, means median nerve is okay. But if patient is not able to touch the pain, means there is a damage in the our median nerve. So remember, it is the test for the median nerve. Getting the point, beta? Now see here, pointing index. What you have to remember, if there is the injury to the our median nerve at the mid forearm, yes, there is the damage at the mid forearm part. Now you will ask the patient to flex the finger. So definitely the ulnar nerve is okay, flexor digitorum profundus is okay, so these two fingers will be flexed. But remember, these all are associated together and the injury is lower, so the few fibers which are supplying this middle finger, yes, that will be also flexed. Also one fact is written in your textbook that this all the tendons are in common synovial sheath, so automatically with these two finger this middle finger is flexed. But this finger which is totally destroyed, yes, the nerve fibers which are supplying to this index finger, it is remaining. Yes, this is getting damaged, so these fibers are remaining intact. This fiber which is supplying to the index finger, it is damaged, so the patient will present with the pointing index. This finger will point towards the doctor. So this is your pointing index. Remember beta, pointing index is found in case of the mid forearm injury. Okay, now try to catch this another one, Oshnert clasp test. This is nothing, you have to ask the patient to make the fist. But when there is the injury to the median nerve at the mid forearm, definitely this finger will point towards the doctor. So this is nothing, the pointing index is the Oshnert clasp test. Pointing index is the Oshnert clasp test. Different country, different author, different way to explain. Okay, now see here, there is a one our another sign, okay sign. This is found positive in case of the, yes, remember, anterior introitious nerve damage. So remember, Salmon boy, आज गाड़ी तेरा भाई चलाएगा. Okay, so what is our okay sign? Anterior introitious nerve syndrome. Normally when we make this okay, can you do this one? What is happening? There is a flexion of this our index finger, there is a flexion of the thumb. Okay, yes, remember the flexion of the thumb is done by the flexor our pollicis brevis, and index finger is also getting flexed. Okay sir, so at this time remember this flexor pollicis brevis is supplied by which nerve? Sir, deep branch of the median nerve, anterior introitious nerve. Getting the point? But if there is damage to the anterior introitious nerve, the patient cannot make the flexion properly. Okay, so here no flexion, but he will present with such kind of presentation. So this will be the presentation. He cannot make the proper okay. Getting the point? Okay. So this is your, yes, anterior introitious nerve syndrome. Remember, this index finger is supplied by the flexor digitorum profundus lateral tendon. Okay, which is also supplied by the our anterior introitious nerve. So what is resulting? The patient is not able to flex the thumb, not able to flex the your, yes, this index finger, so he will not make the proper circle, but he will present with such kind of the finger presentation. Why? Because of the damage to the anterior introitious nerve, the flexor digitorum profundus as well as the flexor pollicis longus, these are paralyzed. Getting the point? Now look here, we are coming for the our ulnar nerve part.